Hello everybody, my name is Hassan Dumbia. In this my topic, I'm going to talk about the responsibility of the first aider. The first aider, how you can manage an unresponsive and not breathing casualty, somebody that is not responding, breathing, how you can treat them. So in this my topic, I'm going to highlight the various steps how you can help someone who is not breathing or an unresponsive person. So I'm going to explain, follow up. Talking about the managing an unresponsive casualty or a person who is not breathing, how we can manage it. We're talking about the principles of resuscitation, right? In basic life support comprise of the following. I'm talking about 4 steps here. Initially assess this person, then the airway maintenance of this person, then you check the chest compression, then rescue and breathing, and expiring ear ventilations, right? I'm going to talk about the principles of resuscitation, right? The cardio and pulmonary resuscitations, that is called the CPR, right? CPR is a method of combined chest compression with an effective rescue breath in order to artificially circulate blood to put air into the lungs of another person. So when you are doing the CPR, it simply means that it's a compression of, like, you compressing the person's chest so the person will be able to gain his normal to resurrect this person, right? Then what is cardio, right? Cardio simply means heart. Then pulmonary means the lungs of the person. Then the R means resuscitation. This is resuscitation, right? It means revives. Then I'm going to talk about 5 steps here. 5 steps of the CPR I'm going to talk about here. Number 1, you have to kneel beside the casualty, the person who have heart attack or fell down. You have to kneel by his side and place the heel of one hand in the center of the casualty chest, in the person's chest. Then place the heel. Then number 2, place the heel of your other hand on the top of the first hand and interlock the finger of your hand. Then number 3, position yourself vertically above the casualty chest and with your arm straight. Then press down press down for 5 to 6 centimeters. After each compression, then you release all of the pressure on the chest without losing contact between your hand and the sternum. Repeat at the rate of 100 to 120 compression. 1, 2, 3, you have to press the person's chest. Then administer 2 effective rescue breath. There you have to put breath on the person's mouth. 1, 2, then you do it again for 30 times. You compress the person's chest for 30 times till the person able to survive, right? In these other steps, I'm going to explain the principle of resuscitation, right? The cardiac pulmonary resuscitation, that is the CPR. These are the instructions you have to look at, right? You have to press the chest 30 times. As you can see in these pictures, the way the finger are, you can see you put your finger exactly the way it is in the middle of the person's chest. Then you have to press for 30 times. Then you have to look the second point wherein you have to give breath. The person 2 breath, 1, 2 on his mouth, right? You have to give him 2 breath. So that is how you have to do it for adults, to save the adults. Then also you have to check for the danger. You have to check for the danger, then check for the response of the person. Then you shout for help. Then you open the airway. Then you check the normal breathing. Then you have to check for the irresponsiveness, like if the person need more emergency, right? Then you're talking about after this person have revived this one, then you're talking about how you can do first aid for infants, like children, how you can do this one. So the whole step of this CPR is to revive someone who have like collapsed. So this is the step for the CPR. Then we're talking about the following step to call the chain of command. I'm going to talk about four steps to call the chain of command. Earlier access to the care or contact the emergency service. Care is necessary or essential. Then early cardiopulmonary resuscitation, learn from the CPR, is the greatest gift you can give your family and your friends. If you perform properly, CPR can help survive or save life until emergency medical teams arrive. Then earlier fibrillations. In most adults, sudden cardio death is related to vertically fibrillation. Quickly defibrillation, deliver of electrical shock is necessary to return the heart to the normal position. Early advanced care after successful defibrillation. Most patients require hospital care to treat and prevent this before further events. In my next topic, I'm going to talk about managing of obstruction airway.